Hello, I am Ashwini here. Welcome back to the YouTube channel of Trueway International. Today we are going to discuss about ACLS. What is it? Why it's done? Who to see? How it's done? Risk and complications? What to expect? Advanced Cardiac Life Support or ACLS is a group of procedures and techniques that treat immediately life-threatening conditions including cardiac arrest, shock, stroke and trauma. ACLS procedures and techniques are arranged into algorithms. Algorithms are a set of standard guidelines that improves the speed, effectiveness and outcomes of ACLS. The goal of ACLS is to stabilize your condition. This includes restoring normal vital signs and alertness. ACLS and other types of intensive medical care save lives. ACLS generally does not reverse or cure an underlying end stage of life-threatening condition. It is not successful in all cases. DNR option that do not use ACLS may be appropriate in some cases, such as in end-stage cancer. Discuss all end-stage disease treatment with your doctor to understand which choices are best for you or your family members. You can specify your choices ahead of time. Now let's discuss about the types of ACLS treatments. Some conditions and diseases require many ACLS procedures and techniques, while others may only use a few. ACLS includes airway stabilizations and treatments including placing a breathing tube in the windpipe, mechanical ventilation using a ventilator assist or perform breathing, arterial line insertion to take continuous blood pressure reading. It also provides a catheter in an artery to draw blood for necessary lab tests. Breathing treatments to open constricted airways due to asthma, allergic reaction or COPD. Cardiopulmonary resuscitation to keep oxygenated blood pumping through the body until the heart and lungs can perform this on their own. This requires pushing down fast and firmly on the chest. Cardioversion to treat certain cardiac arrhythmias. A common example is atrial fibrillation. Cardioversion uses medications or low energy electrical shocks to restore a normal heartbeat. Oxygen therapy to increase the amount of oxygen in the blood. Pacing to correct certain abnormal heartbeats. Why is advanced cardiac life support performed? Advanced cardiac life support treats severe of life-threatening conditions including coma due to stroke, head injury, seizure, meningitis or diabetes. Drug toxicity and chemical exposure including overdose, poisoning or serious adverse effect of medications and street drugs. Heart conditions including cardiac arrest, heart attack, certain congenital heart defects, congestive heart failure and cardiac arrhythmias. Respiratory failure including problems due to asthma, pulmonary edema and pulmonary embolism. Severe allergic reactions including anaphylaxis, a life-threatening allergic reaction. Shock including shock due to severe bleeding, spinal cord injury, heart conditions and sepsis. Who performs advanced cardiac life support? A team of specially trained healthcare providers performs advanced cardiac life support. ACLS teams generally includes doctors, nurses and respiratory therapists. The following doctors perform advanced cardiac life support. Cardiac surgeons specialized in the surgical treatment of conditions of the heart and its blood vessels. Cardiac surgeons may also be known as cardiothoracic surgeons. Cardiologists specialized in the medical treatment of heart disease. Critical care medicine doctors specialize in the diagnosis and management of life-threatening conditions. Emergency medicine and trauma doctors specialize in rapidly diagnosing and treating acute illness, conditions, injuries and complications of chronic diseases. Thoracic surgeons specialize in the surgical treatment of diseases of the chest including the blood vessels, heart, lungs and esophagus. Thoracic surgeons may also be known as cardiothoracic surgeons. How is advanced cardiac life support performed? ACLS is performed anywhere it is needed in a hospital or a clinic. This includes the intensive care unit ICU, emergency room, operating room, recovery area and general medical unit. Paramedics performs ACLS in pre-hospital settings under the guidance of a doctor. ACLS procedure varies depending on a patient's condition. ACLS always includes continuous monitoring of your vital signs, heart rhythms and other important body functions. ACLS generally includes these steps, which occurs very rapidly, often at the same time. Will you feel pain? Your comfort is important to both you and your care team. Some ACLS procedures and techniques are uncomfortable or painful. Patients are often unconscious and unaware of ACLS procedures. You will get sedatives and pain medication so that you stay comfortable if you are alert. Tell a member of your ACLS team if you are uncomfortable. That's all about the common elements of ACLS. I will come up with next video about the risk elements. Until then, stay tuned. Bye bye.